Have you ever really stopped to wonder how a hospital, especially a so-called non-profit one, actually turns a profit? Well, the answer is a lot more complicated and frankly way more disturbing than you probably think. It's a system that's been built on hidden prices, on raw market power, and sometimes on the financial ruin of the very patients it's supposed to help. All right, let's get into it. Everything really clicks into place when you hear a story like this one. Keith Hurry's wife had an emergency appendectomy. You know, the kind of sudden medical crisis that could happen to absolutely anyone. But the bill that came after, that was anything but ordinary. $14,000. And when the Hurndy family couldn't pay it, did they get a manageable payment plan? Nope. They were sued. The hospital went after their paychecks and had their wages garnished. This single medical bill was turned into a legal and financial weapon. And that right there reveals the first, and maybe the most brutal, way hospitals make their money. What happened to the Hurrys wasn't a one-off. It's the result of what we're going to call the debt weapon. This isn't just about sending a few reminders in the mail. No, this is a systematic process that can completely dismantle a person's financial life. And believe me, Keith Hurry's story is far from unique. Hospitals all over the country have sued tens of thousands of their own patients, and the tactics they use are just severe. We're talking about taking money directly from your paycheck, putting liens on your home so you can't sell it, and slapping high interest rates on top of an already impossible bill. In some really extreme cases, they've even tried to get people arrested for missing a court date over a medical debt. These aren't just collection tactics. These are life-altering attacks, all stemming from one single hospital bill. Okay, so that raises a huge question. How do the bills even get that high in the first place? Well, that brings us to the next piece of this puzzle, market domination. It's what happens when one hospital system owns pretty much everything in town. So take a look at this. This is Parkview Field, a minor league baseball stadium in Indiana. Its naming rights belong to Parkview Health, a not-for-profit hospital system. But here's the kicker. While they were busy projecting this image of being a community partner, Parkview Health was also charging some of the highest medical prices in the entire state. How is that even possible? Simple. They bought up all their rivals.
This quote from a Yale economist just nails it. Over the last couple of decades, hospital systems like Parkview have been consolidating power, buying up smaller hospitals and private doctors' offices until they become the only game in town. And, when there's no competition, they can name their price to insurance companies, to employers, and to patients, literally squeezing the financial life out of the whole community.
And here it is in black and white. This is the direct result of that market power. On average, a dominant system like Parkview charges commercial insurance plans more than 260% of what Medicare pays for the exact same service. That huge markup doesn't just vanish into thin air. It gets passed on to all of us through higher insurance premiums and, you guessed it, staggering hospital bills. But owning the whole market is only half the story. The other half is this incredibly bizarre and deceptive billing system that one expert perfectly calls financial roulette. It all starts with this secretive document called the Chargemaster. Just think of it as the hospital's fantasy price list. It's the official rack rate for every single thing they do, from giving you an aspirin to performing open-heart surgery. And these prices, they are wildly inflated, sometimes 50% or more above what pretty much anyone actually pays. So this whole thing creates a tale of two prices. On one side, you've got that massively inflated Chargemaster price, and on the other, you have the much lower, secretly negotiated rate that the big insurance companies get. So who gets stuck paying the fantasy price? Well, it's often the uninsured or anyone who has the bad luck of accidentally going out of network.
Right, so here's the most crucial point. Whether or not you're financially ruined by a hospital stay often has very little to do with the actual care you received. It has everything to do with luck, the luck of having the right insurance at the right hospital at just the right time. It is a game of financial roulette, plain and simple.
And it gets worse. Even when the prices are negotiated and the bills get paid, there's yet another hidden layer where money just gets siphoned right out of the system. It's called the payment scam.
Okay, picture this. Your insurance company needs to pay your doctor. Now, in our modern electronic system, that money often doesn't go straight to the clinic. Instead, it gets routed through a third-party payment processor who takes a cut, anywhere from 1.5% to as much as 5%. It might seem small, but with over $2 trillion in medical claims paid electronically every year, this little skim adds up to billions. The way it works is deceptively simple. The insurer approves a payment. That money gets sent to a middleman. The middleman takes their fee off the top. And then finally,
The doctor or the hospital gets whatever's left. It's basically a toll booth planted right in the middle of the healthcare payment system, collecting cash on every single transaction.
And you have to remember, this is money that could be spent on patient care, on new equipment, on hiring more staff. But instead, it's being diverted into the pockets of financial service companies. It's just another crack in the system where value is extracted, not created. So you hear all this, and you have to wonder, if the system is this broken, is there another way? Well, some experts say yes, and it involves completely flipping the script on how we pay for healthcare. The whole difference really comes down to this. Our current fee-for-service model creates an incentive for volume. The more procedures, the more tests, the more visits a hospital does, the more money it makes. The goal is just to maximize billing. But in an alternative subscription model, doctors get paid a set amount for each patient every month, with the simple goal of keeping them healthy. The entire focus shifts from treating sickness to preventing it in the first place. And the benefits here could be enormous. You'd align everyone's incentives towards actual health, not just billing for treatments. You could slash the billions we waste on administrative costs from that constant back and forth between doctors and insurers, and it gives clinics a steady, reliable income so they don't go bankrupt when fewer people get sick, like, say, during a pandemic. And that leaves us with one final thought. We've just walked through a system that uses debt as a weapon, that uses monopolies to jack up prices, and that quietly siphons billions into the pockets of middlemen. It is, without a doubt, a system built for profit. So the real question you have to ask yourself is it built for your health?